Hi, Kaylin. I'm going to be performing a physical exam on you today. Earlier on, I had already interviewed you, conducted a history and a review of system, and based on your responses, I'm able to determine that your cognitive abilities are intact, your thought processes are logical and coherent, and your speech is clear. I also noted your vital signs, which I had taken, and they're within normal limits. So what I'm going to have you do is if you can just stand 20 feet away from the Snellen chart and then cover one eye and read the lowest line that you're able to.
DEFPOGEC.
And I will have him cover the opposite eye and then with both eyes uncovered, noting his visual acuity, which is 20/20. So if you can sit again on the table. All right, so I'm examining you and your posture is erect. You're dressed appropriately for the season. You're well nourished and well developed, and your mood is appropriate. So I'm going to start with an examination of the head. Throughout our examination, I'm going to be assessing your skin for turgor, for mobility, for temperature, checking for any lesions, for dryness, and for swelling. So I'm just going to be palpating your head. Does anything hurt?
No.
All right, and I'm looking at his scalp, and I don't see any infestations, any flaking, any nits, and the skin tone is uniform, and his hair is smooth, and it's evenly distributed. I don't see any areas of hair loss, okay? And I'm now going to move to the face. Your face is symmetric, and if you can just raise your eyebrows, close your eyes real tight, smile, frown, and puff out your cheeks. I'm also going to test you for sensation. So this is going to be dull, and this is sharp. So if you can close your eyes and tell me what it is you feel.
Dull. Sharp. Dull. Dull.
All right. And I've tested cranial nerves 5 and 7, and they are intact. I'm just going to feel your temporal arteries and your temporomandibular joint. If you can just open and close your mouth, open, and then move it side to side. Very good. And it is mobile. I'm now going to move on to your eyes. So if you can cover one side of the eye, can you do this eye? All right. And I'll cover the same side and let me know when you see my finger without moving your head.
Now. Now. Now.
And then keep that same side covered.
Now. Now. Now.
All right. You can now put your hand down. And then if you can track the movement of my finger without moving your head, just following with your gaze. Okay, so I've assessed your extraocular movement and your peripheral fields, and they are within normal limits. Next, I'm going to be assessing your sclera, and it's white. And if you can just look down first, and then if you can just very good. His conjunctiva is clear. There isn't any discharge and crusting or lid inflammation. I am going to check your pupillary reaction. So again, if you can look behind my shoulder, and so I'm going to note pupillary reaction directly, and I'm going to repeat the motion now looking at the opposite eye. So the pupils are equal, they're round, reactive to light. And if you can just look at this pen light and track the movement, look behind my shoulder, look again at the pen light, and the eyeballs converge. Okay, so now I'm going to look at the back of your eye using my ophthalmoscope, and I'm going to get real close, so don't be nervous. So I'm going to use my left eye, identifying the red reflex. Once I see the red reflex, I'm going to work my way closer. Okay. And I'm noting the general background, and I'm also looking at the vessels, the optic disc, as well as the macula. Next, I'm going to be examining your ear. So your ear is even in color and any areas of pain when I press.
No.
Alright, and I don't see any swelling, discoloration, or discharge. I'm going to use my otoscope and I'm just going to pull your pinna up and back, looking at the tympanic membrane, and I see that it is pearly gray and the cone of light is not displaced. I'm going to check your hearing acuity, so if you can cover one ear, and I'm going to whisper something and let me know what it is. Flash drive.
Flash drive.
And I would do the same on the opposite ear. So if I had any concerns about your hearing, I would perform a Weber and a Rhine test. So let me know whether you hear the vibrations equally when I put the tuning fork on top of your head.
Yes.
It is equal?
Yes.
Okay. Next, I'm going to measure air conduction and bone conduction. Let me know when you stop hearing the vibrations when I put the tuning fork behind your ear.
Now.
Do you still hear it?
Yes.
And I would expect the vibrations to be heard longer with the tuning fork placed next to his ear. Alright, so now I'm going to assess your nares. So if you can just tilt your head back a little bit, I'm checking the turbinates. I don't see any areas of bleeding or lesions. And if you can cover one nair at a time and breathe in and out, and do the opposite nair. Okay? And then if you can just close your eyes and tell me what it is you smell.
Pepper.
Very good. It is peppermint. So I'm now going to check your sinuses. So this is going to be the frontal sinus. Does it hurt?
No.
And the maxillary sinus. Does that hurt?
No.
So your paranasal sinuses are non-tender. Next, I'm going to move on to your mouth. Okay? So his lips are moist, and if you can just open your mouth, I'm checking his teeth, and they're in good repair. His gums are pink. I'm looking at the soft palate as well as the hard palate, and if you can just say, ah. His tonsils are 1+, the uvula rise is midline, and his oropharynx is pink, and I don't see any exudates. Alright, so next I am going to assess your neck. So if you can just first tilt your head back, forward, look left, look right, and then touch your left ear with your left shoulder, and then the opposite. Okay, very good. And if you can just resist, turn your face, very good, and the opposite side, and then if you can shrug your shoulder. And I tested cranial nerve 11, which is intact. Next, I'm going to feel your lymph nodes. So this is the preauricular, the posterior auricular, occipital, jugulodigastric or tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular. And your lymph nodes are non-palpable. Next, I'm going to look at your trachea, and if you can just swallow. Very good. It is midline, and I'm going to now palpate your thyroid gland. So if you can just tilt your head a little forward and then to the side. So I'm palpating and then do the opposite. And I'm palpating. And his thyroid is non-palpable. If it was enlarged, I would also auscultate the thyroid gland for any bruit. Now I'm going to check your carotids first by auscultating it with the bell of my stethoscope. Okay. And then I'm going to do the same on the opposite side. And then I'm going to palpate it. Okay, and I'm making sure that I palpate it one at a time. Next, I'm going to just look at your extremities. So does anything hurt when I press on your shoulders,
No.
the elbows,
No.
the wrists,
No.
and the fingers?
No.
And while I'm here, I'm checking for capillary refill, and I see that it is under 2 seconds, and that's normal. I'm just going to check your epitrochlear lymph node, and it is non-palpable. Okay, your skin is warm, and the turgor is good. It's not dry. I see some areas of redness or rash on your flexor surfaces. But other than that, it's also adequately perfused. So next, I am going to just have you close your eyes and ask you to identify what it is I placed in your hand.
Key.
Very good. And then the opposite hand.
Nail.
Good. And I'm going to have you identify a letter that I write on your hand.
D.
Good. And a number.
1.
Very good. So I've assessed stereognosis and graphesthesia. Now if you can just tap your lap. Very good. And next I am going to assess for deep tendon reflexes. So first I'm checking the triceps. If you can let your arm hang loosely. Okay, good. And next I'm going to check your brachial. All right, and if you can relax your arm, I'm checking the brachioradialis. Okay, and it is 2+. So I did the deep tendon reflexes. Now for range of motion, if you can just bend your arm. All right, and if you can push against my arms, very good, good strength. And then if you can put your arms behind your shoulder, behind your head, and behind your back. Very good. And if you can just open and close and bend your wrist. So I've checked for range of motion on the upper extremities. All right. I would have also checked for brachial pulse, the radial pulse, and the ulnar pulse, and it is 2+. Now I'm going to move on to the back. I'm going to start by assessing his posterior torso. The skin is uniform in color, and I don't see any rashes or lesions. And the AP diameter is less than the transverse diameter, and I don't see any accessory muscle use. So if you can just say 99.
99. 99. 99. 99. 99.
And if you can take a deep breath. Okay, so I've assessed tactile fremitus, which is even, as well as chest expansion, which is symmetric. Next, I'm going to percuss, working my way side by side and comparing. Okay, and it is resonant throughout. And next, I'm going to be auscultating. Take deep breaths. Okay. Since I'm here, I'm also going to be checking you for costovertebral angle tenderness. So let me know if this movement hurts. Does that hurt?
No.
Okay. So I'm going to move now to the front, and whatever I did on the back, I'll do the same in the front. So I'm checking for accessory muscle use, and he is breathing spontaneously and without retractions. So next I'm going to have you again say 99.
99. 99. 99.
And if you can take a deep breath. Very good. So I've assessed for tactile fremitus as well as chest expansion, and chest expansion is symmetric. Next I'm going to percuss. And it is resonant, and now I am going to auscultate. And lung sounds are clear and there is no respiratory effort. Now I'm going to have you lay down. Okay. All right, lay back. And if you can just look at the opposite side, and I'm noting any distension on his neck, checking for jugular venous pressure. I'm also examining the precordium, and I don't see any heaves, lifts, or thrills. I'm just palpating the apical pulse, which is at the left fifth intercostal space, midclavicular line. And I'm also feeling the sternal border as well as the base of the heart. Okay, so next I'm going to be auscultating. First, I'm going to use the diaphragm of my stethoscope, listening at the aortic, the pulmonic, the Erb's point, the tricuspid, as well as the mitral. And I'm going to do the same thing over using the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Okay? And if you can just turn on your left, and I just want to make sure that if there is any murmur present that I don't miss it. And I'm auscultating at the fifth intercostal space. Okay? You can lay on your back now. Okay? So I hear S1 and S2 and the rhythm is regular and I don't hear any murmurs, gallops, or extra heart sounds. So now I'm going to examine your belly and I'm going to note any abnormal pulsations, and the skin is uniform in color and it is flat. So first I am going to auscultate. Okay, working my way around from the right lower quad. Okay, and bowel sounds are normal active. Since I'm here, I am just going to also auscultate the vascular sounds using the bell of my stethoscope. So I'm going to listen at the aorta, the renal, the iliac, and the femoral. And I don't hear any bruit. Next, I am going to percuss your abdomen. Okay, and it is tympanitic. And now I'm going to just lightly palpate first, and then deeply palpate. Any pain?
No.
Okay, very good. So I just want you to take a deep breath, checking for the liver, and then I'm going to assess the spleen. If you can just raise a little bit, very good. And then if you can relax, I'm going to check your kidneys. And I don't feel them. There is no organomegaly. Next, I am moving to his lower extremities, and I see that the skin again is uniform in color, hair distribution is appropriate, and does anything hurt when I palpate the hips, the knees,
No.
the ankles?
No.
While I'm here, I'm also going to palpate the popliteal pulses. I already palpated the femoral, so now I'm going to work my popliteal. And then for the dorsalis pedis, as well as the posterior tibialis, and it is 2+. I'm also going to check for capillary refill, and it is under 2 seconds. I don't see any swelling. So now I'm going to have you raise your one leg, raise it up, and then move it to the side, outward, and then inward, and then bend your knee, and again, move it inward and outward. Okay, very good. And his range of motion is intact. Next, I am going to just check you for your sensation. So this is going to be sharp and this is dull. Did I do this on your arms as well?
No.
I don't think I did. So I'm going to do that. I'm going to do the upper and the lower extremities at the same time. So tell me what you feel.
Soft, sharp, soft, sharp, soft, sharp.
Okay, and his sensations are intact. So now I am going to have you sit up. Okay, and I'm going to check your deep tendon reflexes on the knee. Okay, very good. It is 2 plus, and next I'm going to do the Achilles. If you can just, there, let it hang. Okay, and that is also 2 plus. All right, if you can just stroke your leg with the heel of the opposite, working your way down from the knee down to the foot. Very good. And he is able to perform that appropriately. So now I am going to have you stand. Okay? And if you can just walk forward, and then on your way back, work heel to toe. Very good. And if you can just face forward and then hop on one foot, one leg at a time, and then the opposite leg. Very good. And I'm just going to have you stand for a moment and close your eyes. And I'm looking for sway. I'm checking for Romberg, and I don't see any. Now, if you can just face the wall, touch your toes, and I'm assessing for scoliosis looking at his spine. Now, if you can stand, face me, and then if you can just bend back, forward, to your left, the opposite side, and then turn on your waist. Very good. And so the range of motion of his spine is normal. One of the things that I asked you to do before we started the physical exam was to remember 3 words. Are you able to recall them now? What were the 3 words?
Ball, door, phone.
Very good. So you were able to recall them appropriately. And that concludes our physical assessment on Kalen today. Thank you.